Students, please make a note. So every week we do 1 unit. And after you're done with 13 units, then we look into your placement. All right. Now, under this particular topic, recognize healthy body systems. And under this particular unit, we have 2 topics: work with information about the human body, recognize and promote ways to support healthy functioning of the body. So these are the 2 topics that we have under this particular unit. Just give me a second, guys. So what is the purpose of this unit, and why do you have to do this unit? Now, when you're working in an aged care, or when you're working with elderly people, you need to make sure that if you come across any unusual instances or any illnesses or any kind of symptoms of illnesses, we need to make sure that we report that to our supervisor immediately, depending on what kind of issues are you're coming across. So that's the purpose of the unit. So by doing this particular unit, you should be able to recognize when to report and what to report. Okay. And when different body changes are happening, you will be able to understand what exactly is happening with the client. And that's the purpose of this particular unit. I hope that is clear for everyone. Now, it is fairly a very short unit. In the assessments also, I believe there are only 12 questions that you have to address for this particular unit. So let's get started. So when you're working in the industry, it's very important for us to be aware of the anatomical terminology, because if you are not very clear with the anatomical terminology, you will not be able to express yourself correctly. And if you don't express yourself correctly, the other person who you're reporting may be confused with your information, or you may not be able to understand what you have said or what you're saying to the supervisors or any other healthcare professionals. That's why it's very important for us to understand the anatomical terminology. Now, as we all know, that doctors, nurses, and other healthcare professionals, they go to different schools throughout the world. But they come and work together in one hospital or in one aged care, and they effectively communicate with each other because of this anatomical terminology. And using proper anatomical healthcare terminology will help us to avoid any confusions. Because if you're using imprecise terminology, it can lead to the confusions and incorrect assumptions. As we all know that we are working in a healthcare industry where incorrect assumptions will lead to incorrect treatment. And obviously that will affect the quality of services and will eventually lead to neglect and some other legal issues. So it is very imperative that we all understand and communicate effectively in order to know the true situation of your client. Now, sometimes when you're communicating, we should not be using certain terminology. For example, you got a couple of examples in this slide. We cannot use words like mentally retarded or homosexuality as a disease. Okay, so that's very important. And moving to the next one is when we are talking about the body locations, we always assume that a person is in a standing position, which is called as standard anatomical position. So all descriptions of the human body are based on the assumption that an individual is standing. That's which is known as standard anatomical position. So we need to learn few terms that actually I'll be showing you a video. In this particular unit, I'll be showing few videos for you to understand it better. So there are certain words that you will be using when you are reporting. For example, you're using superior, inferior, anterior, posterior, medial. You might use these words when you are writing your notes or when you are reporting to the supervisor. Now, some common names are also very important for you to use. For example, a lot of people refer to arm as a hand. Arm is different from hand. Arm, elbow, the exact location. For example, if your client had some injury on his feet, okay. Now, which side of the body was it? Was it left hand side? Was it the right? So left feet. where exactly the location is. You might have to report this to your supervisor. So location is also very important. So certainly there are some common words that we may use when we are reporting. Example, head, forehead, jaw, cheek, chin, neck, shoulder, arm, elbow, wrist, hand, fingers, thumb, spine, chest, thorax, abdomen, groin, hip, buttocks, leg, thigh, knee, calf, heel, ankle, foot, and toe. I believe most of them are very common words, but if you're looking at groin, groin is this area, the center, near the private parts. That's groin. Okay. Now, apart from that, all other are very common names that you might know. Now, in order to understand these positions, the body position and the anatomical terminology, I'll play a very short video on anatomical positions. So please carefully watch this video and try to remember them. You also have this information in your PowerPoint slides as well.
This directional language or terminology is used in reference to the anatomical directional terms. A directional language of anatomy exists in order to minimize confusion when discussing areas or specific points on the body. This directional language or terminology is used in reference to the anatomical position. The anatomical position is when a person stands erect, face pointing forward, arms at the sides, palms facing forward, and feet also pointing forward. If everyone is looking at the body in the exact same position, there will be less confusion when discussing anything related to anatomy. We're going to start with superior and inferior. Superior means toward the head, but it can also mean upper or above. Inferior means toward the feet, but it can also mean lower or below. So we would say that the heart is located superior to the small intestine, or we could say the small intestine is located inferior to the heart. Next is anterior and posterior. Anterior means further to the front or in front of. Posterior means further to the back or in back of. So we would say the sternum is anterior to the heart and the heart is posterior to the sternum. Sometimes the terms ventral and dorsal are used in place of anterior and posterior, where ventral means anterior and dorsal means posterior. Anterior and posterior can also be used to describe how you're looking at the body. While the body will always be referenced from the anatomical position, it can be viewed from an anterior view, meaning looking at the body from the front, and it can also be viewed from the posterior view, meaning looking at it from the back. Medial and lateral are another set of directional terms. Medial means toward the midline of the body, and lateral means toward the side of the body, or away from the midline of the body, where the midline is an imaginary line that divides the body into left and right halves. So we would say that the heart lies medial to the lungs, or you could say that the lungs lie lateral to the heart. Lateral can also be used to describe how you're looking at the body. While the body will always be referenced from the anatomical position, it can be viewed from the lateral view, meaning looking at the body from the side. Next is proximal and distal. Proximal and distal are terms that are usually used when describing parts of the appendicular body. Remember that the axial body consists of the head, neck, and trunk, and the appendicular body consists of the limbs, or appendages that are added to the axial body. Proximal means closer to the axial body, or toward the trunk of the body, and distal means further from the axial body, or further from the trunk of the body. So we would say the thigh is proximal to the foot, or you could say the foot is distal to the thigh. Superficial and deep are another set of directional terms. Superficial means closer to the surface of the body, and deep means further away from the surface of the body. So we would say the sternum is superficial to the lungs, or the lungs are deep to the sternum. Remember, this is the case when we're looking at the body from the front or anterior view, when it's in the anatomical position. And that be the anatomical direction.
Now,
when I was 12, I got an HR of 99.25. So if you've got a student in year 7.
I hope that is clear. So for example, if you're looking at your PowerPoint slides, so For example, this is where it is. So lateral, superficial, deep, external, internal, distal, superior, inferior, anterior, posterior, and medial. Now, when do I use these kind of terms? When I'm reporting to my supervisor, when I'm writing notes, for example, the rash is very superficial, the scratch is very superficial, the cut is deep. These kind of words you might use when you're reporting to the supervisor. Again, when you're doing this particular unit, this unit is to just make sure that you're aware of different body systems and aware of some terms that way you may use when you are reporting or completing the documentation. This unit does not allow you to assess anyone's condition. Okay. Now, as I have mentioned earlier in different units, I did mention about that you will only be doing activities of daily living for your clients. Now, for example, you take a shower, you give a shower to the client. You brush your teeth, you assist your client with brushing their teeth. Now, anything that comes in between, for example, while you're giving a shower, you saw a bruise, or there was a skin tear, or there was some other problem, then you're not supposed to assess. All you need to do is go and report it to your supervisor. Then the supervisors or other healthcare professionals like physios, doctors, dietitians, they will look into the problems, or your nurses will look into the problems. Now, your purpose of this unit is to ensure that you just report it and you report it in the correct way and understand your client's situation and support them accordingly. Is that clear for everyone? Okay. Now, moving to the next one. In our body, we have multiple trillions and millions of cells. Okay. So what are these cells? So what do they do? The cells together, they become tissues. Okay. These tissues together, they become organs. And the organs together form organ systems. So we have different organ systems that in our body, there are about 11 organ systems that support our body. But before we get to the organ systems, let's look into the cell. The principal parts of human cell are plasma membrane, which is the outer membrane, and this separates the cell's internal parts from the extracellular material and external environment. Then we have another principal cell, which is called cytosol, which refers to all cellular content between the plasma membrane and nucleus. Then we have organelles, which are highly organized structures with characteristic shapes that are specialized for specific cellular activity. And then we have the nucleus, which is the control center of the cell. Now, I request everyone to please write down the principal parts of human cell: plasma membrane, cytosol, organelles, and nucleus. I want everyone to please write this down. Just write down the principal parts: cell membrane or plasma membrane, cytosol, organelles, and nucleus. All right, now we're going to look into the organ systems. And before I discuss with you about the organ systems, we will be watching a short video on different organ systems. And then I'll explain about what you need to do when it comes to different organ systems in an aged care, okay, as a personal care assistant.
There are 12 systems in the body. Remember that similar cells form tissues, similar tissues form organs, different organs then interact to form systems. Different systems then work together to form an organism. In this video, we will learn about the 12 important systems in the body and how they function. Integumentary system, skeletal system, muscular system, nervous system, circulatory system, respiratory system, digestive system, excretory system, urinary or renal system, reproductive system, endocrine system, immune system. Integumentary system. This system forms the outermost layer of animals.
If you want to ace your paper, download Grammarly. Are you?
It helps to protect what comes in and what goes out of the body. It consists of the skin, nails, hair, and some glands. Skeletal system. This system consists of bones that helps to support the body and protects the organs inside the body. Bones also produce blood cells in the bone marrow. Muscular system. This system consists of muscles that help the body to move around. They do this by contracting and relaxing. There are 3 types of muscles in the body: skeletal muscles, cardiac muscles, and smooth muscles. This system is also referred to as the musculoskeletal system. Some muscles are attached to bones, and they help to hold the bones in place. Muscles also help to move blood around the body. Nervous system. This consists of the brain, spinal cord, and nerves making up the central nervous system and peripheral nervous system. The system works by sending electrical impulses around the body, enabling them to move. Circulatory system. This system consists of the heart and blood vessels. The heart pumps blood around the body via blood vessels and removes any waste products. Respiratory system. This system works to provide oxygen into the bloodstream from the air which we inhale and releases carbon dioxide when we exhale. This occurs automatically, without you even having to think about it. It's part of the autonomic nervous system. It's made up of the nose, the pharynx, the larynx, the esophagus, and the lungs. Digestive system. This system works to process the food that's eaten into substances so that the body can use it as energy. In order to do this, the food that's eaten passes through the digestive system. There are many body parts and organs that have different roles in this system. The parts of the body involved are mouth, tongue, teeth, esophagus, stomach, pancreas, liver, gallbladder, small intestine, and large intestine. This broken food that passes through the large intestine turns into solid waste material. This is then removed from the body via the process of excretion. This occurs in the excretory system. Urinary system or renal system. This system consists of the kidneys, ureters, bladder, and urethra. The kidneys receive unfiltered blood from the renal artery. The kidneys then work to filter the blood by identifying useful and waste products in the blood. The waste products and excess fluid in the blood is removed and released as urine. The urine produced travels down the ureters from each kidney into the bladder. The bladder stretches to store the urine and then contracts when releasing urine via the urethra. Reproductive system. This system differs in males and females. It's where the process of fertilization occurs. Endocrine system. This system consists of glands that help to regulate the processes in the body. The glands in the body are able to detect and distribute hormones around the body. Immune system. This is also known as the lymphatic system. It works to detect foreign cells and sends white blood cells to fight infections. Therefore, it's a very important part of our body.
All right, guys, let's do the quiz. Couple of questions. Any answers?
Urinary system.
It's urinary system. Which system consists of brain, spinal cord, and nerves?
Nervous system.
What is the role of the excretory system?
To remove waste products.
Removes the waste products. Which system consists of heart and blood vessels?
Circulatory system.
Circulatory system. Which system regulates produces hormones? Endocrine. Which system breaks down the food?
Digestive
Digestive system.
Digestive system. All right, so that's now. So always mention it as 11 body systems because we don't really talk much about reproductive system when it comes to elderly people. Moving to the next one is what are we going to do when it comes to these different body systems and what are the things that we need to be careful about? Now, for example, when it comes to integumentary system, now I want everyone to please understand the organs for each body system. You may have to write for one of the questions. So please remember, these are the organs for integumentary systems: skin, hair, nails, the organs. Okay. Now, when it comes to integumentary system, what is that we have to do? Obviously, you're working with elderly clients. Their skin is very fragile, and there are high chances that they will be having dry skin. Now, how do you manage this if they have a dry skin, and what do I have to do? Now, when you come across a client who is having a really terrible dry skin and there are, dry skin flakes around in the bed, you need to immediately report this to your supervisor. In general, if you observe dry skin, it's always important that you report to supervisor, but if you see that it is really bad, then you definitely have to get the supervisor to review it. But in general, if you see dry skin, you just report it to your supervisor. They may not come and have a look, but they might write notes and request doctor to review it and write some kind of medication or ointment. Now, usually in an aged care, after you give a shower to the client, you apply moisturizer. You dry them up very well. The body should not be wet when you're applying the moisturizer, especially in between the feet. I mean to say the fingers, the toenails, toes. You need to make sure that you dry them up very well before you apply moisturizer. And also, if you come across any skin tears, you will be reporting it to your supervisor. I'll show you some images for you to understand this, what I'm talking about when I say skin tear. Now, the chances of an elderly person having a skin tear are very high because of fragile skin. Strips. Now, these are some of the examples, guys. So your client may have a skin tears like this. For example, they may have a bruise and there might be a skin tear like this. Now, when they have a skin tear like this, you report it to your supervisor. And what they do is they apply steri strips. Now, these are the steri strips. What they do is basically they join the skin using the steri strips. They apply the steri strips and leave it on the client. Now, they might leave it on the client for about a week. Now, this area must be kept dry at all times. Now, why do you have to be aware of this? Because you will come across skin tears, you report to supervisor, and once they apply these steri strips on the dry skin to join the skin, you should not be wetting them when you give a shower to the client. So what do? I put a plastic bag or something to protect it, or ask the client to put the hand away, depending on the situation, depending on how big and where exactly the skin tear is. Then they leave it for a little while and you do not remove it. You let the supervisors remove it, because if you're not being careful when you're removing, you might again tear the skin. Is that clear for everyone? Now, these are the things that you need to be aware of when it comes to integumentary system. And another thing that you may also come across when it comes to integumentary system is rashes. Now, sometimes the nappy rashes that you call for the babies, the same way you have continence aid rashes for elderly people. Now, when they have this continence aid rashes, the doctors might recommend some kind of ointments or creams. So you need to apply this according to the directions of the doctor. If it's something that is really serious, most of the time the nurses will come and do it. If it's more medicinal, if it's just a moisturizer kind of thing, then they might ask you to do it. Now, without the recommendation of a doctor or a nurse, you are not supposed to apply any cream that you like, apart from normal moisturizer. Normal moisturizers are okay. For example, you might come across Soberlin. Soberlin is a normal moisturizer. And some other Nivea, these kind of creams are okay. But if you are talking about any kind of medicinal one and you're not aware of it on how to use it, then you always contact your supervisors. And coming to the next thing, there is something called, this is a very popular one. For example, if someone has a real bad skin, usually what they recommend is, doctors recommend this particular cream called Dermis. Okay, especially when this is like Vaseline. It's very thick. So they might ask you to apply Vaseline. So Dermis is fine. Dermis, if your supervisors, but you have to again go by the instructions that are written, because sometimes your supervisors might be busy during the day, especially when you give a shower. You can't keep asking your supervisor to come and help. They might probably advise you to apply this Dermis cream, which is okay. But again, you have to look at how many times can you apply per day. Maybe once in the morning and once in the evening, So you have to go by what is written by the doctor or advice from the supervisor. Now, moving to the next body system is about skeletal system. Skeletal system, and I'll also talk about a little bit about endocrine system as well. So in skeletal system, so one of the things that you need to be aware of when it comes to skeletal system is as people age, their bone density reduces. Okay, the bones become weaker. Okay, this is also part of the endocrine system because endocrine system also contributes to weakened bones. Now, because of these, your clients may have fractures very easily because, for example, if people like us who are a bit young, so if you fall out of the bed, most likely you might have a bit of muscle pain. But if an elderly person falls out of the bed, there is a high chances that their bone would have broken. Now, because the bones are sensitive. Now, if you see someone on the floor, what would you do? As a PCA, if you see someone on the floor, what you would do? Will you lift them? Yes or no?
No, ask assistance.
We ask for assistance. Basically, we call supervisor, and we are asking supervisors to check and let us know so that we can lift this person and put them to bed. Now, who can tell me why are we asking supervisor to come and check?
They'll have to assess the client.
And why are we not doing it?
To avoid the further harm.
That's fine, but why are we not doing it?
It's not on our job description to do it.
It's beyond our job description. Absolutely right. It's beyond our job description, and we don't know. And we may know sometimes, but we're not qualified. And one of the things that you need to be careful is, especially if your client says that they have terrible pain, then it is most likely that the person would have had a fracture. Now, this is only for your understanding. Again, this is not for your assessing. Now, usually if a person has a fracture, one leg is shorter than the other. One limb is shorter than the other. Usually if they have a fracture, that's 100% fracture. If you put them together and you see one leg shorter than the other, then it is 100% fracture. But however, you're not supposed to assess. You have to wait for your supervisor and let your supervisor check. Now, moving to the next body system is muscular system and say skeletal, skeletal system already, muscular system. Now, one of your client is complaining of pain. What do you do? One of your client is complaining of pain, and she said that she has Panadol in her drawer, and she's asking you to assist her with that Panadol. What would you do?
Report supervisor.
Can you give the Panadol?
No.
Now, 100% you're not medication endorsed. None of them are medication endorsed. I'm not teaching medication course in this particular unit, in this particular medication unit in this particular course. So none of them are supposed to give any medication to your client. Okay. Now, when they complain of pain, you report it to supervisor. What happens if you forget a few times and the client is continuously in pain? What happens? Your client told you that she has pain. You forgot to report today, and you forgot to report tomorrow as well. For example, and the client has been in pain for last 2-3 days, but she has been continuously reporting it to you, and you did nothing about it. Then what happens?
Is it for incident report?
Yes, but what happens with you if you continuously forget and the client is in pain? Not just once, it happened like 2-3 times, and the client is in pain from last 2-3 days.
Make a note. You might be called by your supervisor.
Now, you will definitely be called by your supervisor, but your file will have a note saying that you were under neglect, especially when it comes to pain or anything that is causing harm to the client. it will be written as a neglect by you, personally by you. If you have been identified that the client has reported to you multiple times and you did nothing about it. Now, once they report it and you go and report it to the supervisor, you told the supervisor that the client is saying that the medication she is getting now is not sufficient and she is continuously in the pain. You have reported this to supervisor, you're safe. But if you do not report, then you fall under neglect, and neglect goes on your personal files. So be aware of that, okay? And one of the things that you need to remember is there's nothing much you can do about muscular system. All you need to do is if the client is complaining, because usually in the old age, a lot of people complain about their muscle pain. Okay, this is one of the things that you need to be very careful about. And also you might encourage clients to do a bit of activities in order to improve the muscle strength and the bone strength. Just to encourage them to do some daily activities like, exercise and so on. Now, moving to the next one is about cardiovascular system, respiratory system. Now, cardiovascular system. Let me ask you one question. Let me know if you have any questions anyways, but you've been to one of this client, and the client started sweating, and he is complaining of pain in his left arm. And then the pain is radiating into the shoulder, then into the neck, then into the jaw. And the client tells you, I feel like vomiting or toilet, I don't know, but I just need to go to toilet right now. What is your action?
We immediately report
Immediately call the supervisor.
How do you call the supervisor? Do you go and call the supervisor, or how?
We say that maybe some symptom of heart attack.
So when someone has a symptom of heart attack, how are you going? Do you leave the client and go, or do you stay with the client and call? What is your action, exact action? Brief description.
We call, sorry, we will be there, but we ask for assistance at the same time. Because we have.
How do you ask for assistance? Do you go out and call the supervisor? What do we do?
We may ask the person who is near around us, someone to assist.
Now there is something that's fine, guys, because obviously you may not have been to an aged care, most of you. So in an aged care, you have there are two kinds of buzzer. One buzzer is to call for help.
Yeah.
The other buzzer is to call in case of emergency. So you press this red buzzer, everyone in the facility will be alerted. And definitely at least 2 to 3 people will walk to that particular room, including your supervisor. So because they know that there is some emergency. And obviously when a person is complaining of heart attack, your supervisors are there who are, usually when you have supervisors, you just call them, they call an ambulance, or they might allocate someone to call an ambulance. And we need to be prepared. We may have to do CPR on the person. So we need to be prepared. So it's better to have at least 2 people. And as a backup, you might have more than 2 people, because doing compression CPR could be very exhausting. So it's better to have multiple people around you for help. In case one gets tired, the next person starts to continue to provide CPR. Is that clear for everyone? Now, moving to the next system is about respiratory system. Now, your clients might complain about asthma or shortness of breath, and some of your clients may also have these oxygen cylinders that they might be using on a day-to-day basis. Now, if they are using an oxygen cylinder, and obviously the oxygen cylinders have a particular level of oxygen set, like 2 liters or 1 liter, whatever. It's according to the doctor's recommendation. Again, you don't have to worry about it. It's set at a certain level so that the client can breathe comfortably. Now, this is not something that we do. Okay. Now, if the client is complaining, or if you observe that the client is not able to breathe properly, or the client is turning blue is emergency. Okay, which means the person is dying. All right. So you immediately report to supervisor, obviously. But if you see that a person is uncomfortable in breathing, or is not comfortably breathing, then you might have to call your supervisors, because they may have to increase the oxygen levels for that particular client. Okay. Now, apart from that, if they're not on the oxygen cylinder and they're having difficulties in breathing, again, you report to your supervisor, because some clients may have asthma and they might need a puffer. Again, can I give a puffer? Puffer is considered to be as a medication, and we do not give it. It is given by the supervisors. Now, moving to the next system is about nervous system. Nervous system is one of the body systems that is considered to be as a communication system. I call it as a communication system because everything that happens in our body and everything else that you want to communicate between the different other body systems, it is done through nervous system. Nervous system does some voluntary work and involuntary work. For example, if you have to reach a pen, you reach a pen because the information you're sending through to your brain is through nervous system. And then the muscle and the bones are moving to catch or grab a pen. So this nervous system is more like our internal wiring system, which helps in communication. So if at all, if your clients, that's when you have problems when people have issues with the nervous system, they may have dementia, where they may not be able to comprehend, or they may not be able to think appropriately or do their activities of daily living, which will be covered in your dementia unit, however. So one of the other things that you need to remember is people may have, because of some disorders in the nervous system or damaged nervous system, elderly people may have something called seizures. Now, you know what seizures are? Epilepsy or seizures. People, like, they go like this, shake. Okay. In most of the, some countries, we also call it as fits. Okay. It's also called epilepsy and seizures. Now, if a client, if you're providing service and the client starts to have seizure, then you never go and stop that seizure. I repeat myself, you don't go and hold their arms or hold their legs. Seizure is a vibration that has to get out of the body, all right? And these seizures may last, sometimes they only last for 1 minute, sometimes they may last for 2 minutes, sometimes they may last for 5 minutes. Okay. Now, as soon as the seizures start, we do not give them anything to eat, anything to drink, and we do not restrain the seizures, which means that we don't go and hold on to the person and try to stop that seizure. Is that clear for everyone?
Yeah.
Now, all we do is we immediately report it to our supervisor, and this is just for your information again. Supervisors may not call an ambulance straight away. May not. Okay, sometimes they wait because if the person has a history of seizures, so probably they wait for 1 or 2 minutes to see if it stops, and sometimes it might stop and it might start again. Now, if that's stopping and starting recurring again and again, then they may call an ambulance to send the person to the hospital. But after 1 minute, if it stops and the person is okay, and usually people who after having a seizure, they might go into deep sleep as well. Okay, so we need to continuously monitor, and the supervisors will be the one to assess. But all I need to do is I report it to supervisor. I do not give anything to eat, anything to drink. I do not go and stop the seizure. And if at all, if you see something close by to the person, because usually most of the time, maybe the client is on the bed, but do you have a hot cup of coffee next to him? Because seizures, the person doesn't have control. They might just hit that coffee and it spills on them or anyone else. So you need to make sure that the area is clear and let the seizure complete its course, and do not give them anything to eat or drink. Now, I'm repeating this, do not give them anything to eat and drink, is because if you give them anything to eat and drink, along with seizures, they're going to be choking as well, because they will not have that power to consume. Okay, swallow. All right.
Can I have one question, please?
Sure.
In case a person is standing and he got a seizure,
They usually they drop.
they drop.
They drop onto the floor.
So we need to be careful. We need, as you said, you don't need to hold the person. So how?
Hold is I'm talking about restraining, because a lot of people may not understand the word restrain. So that's why I'm using the word hold, which means that I'm not asking you to, you do not hold the seizures or you do not restrain the seizures. But it depends. Again, if the person is standing, Usually people don't really have, I haven't seen any, but you never know. So if at all, if they have a shiza when they're standing, you gently slide them down if you can, only if you can, only if you can. Again, this is something to do with work health and safety. Okay. If a person is 100 kilos, okay, and then this person is having a shiza standing, well, if he falls, he falls. I'm not going to fall along with him and get hurt. Okay, that's something else that I'm going to talk in a different unit. But for now, so you slide the person where possible, and the person will have a seizures wherever they are. They're on the floor, they're on the bed, they're on the chair, whatever, wherever position. But it's very important. For example, someone is shaking the hand or shaking the legs. Don't go and hold the arms. Don't go and hold the legs. Okay, that's what I mean by restrain or hold. Okay, now I hope that's clear for you, Jyoti.
Yes, thank you.
Now, moving to the next one is, apart from the seizures, people usually also have issues like Parkinson's, okay, which is also a part of one of the diseases that may also contribute towards the dementia. But in this particular condition where people have Parkinson's, they might be shaking their hand like this, they may not have control, they shiver, they're trembling most of the time or shivering, okay. Now, in those situations, the clients may have difficulty in eating or difficulty in moving things and so on. So if you come across a client who is having Parkinson's, usually they will be recommended to have thicker spoons, especially when they're eating. And they're given special cups so that they can hold onto the cups when they drink, especially the cups that have two handles, so that they can hold these cups with both hands to sip. Okay, so that's also one of the things that you may have to remember, especially when someone has a nerve disorder. And so these are some of the body systems that you may have to be aware of. And coming to the next one is about digestive system. When it comes to the digestive system, our responsibility is to make sure that our clients are going to the toilet on a regular basis. If they have not been to the toilet, or if they're having any issues of constipation, we report that to our supervisor. And when it comes to not opening a bowel, okay, if someone has not been to the toilet, number two, if they have not been to toilet for last 2 days, then it becomes our responsibility to report out to our supervisor. Is that clear for everyone? Now, you might also sometimes see that your clients are having distended stomach, and it's very hard, okay? Now, in those circumstances also, you may have to report it to your supervisor so that the supervisors can review it. And moving to the next one is, and one other thing I wanted to show is there's something called a colostomy bag. Now, you may not come across much, but at some point you'll come across. Now, these colostomy bags, some clients may have issues with their bowels, and they may not be able to have good bowel motions, or they might be having some issues with their bowels. So in those situations, the doctors recommend a colostomy bag, which is attached to the internal organ. So this particular bag actually collects the feces, collects the waste, okay? That waste goes into this particular bag. Now, you may come across a client who is having this colostomy bag on them. Now, this is attached to the organ. So we do not assist a client with a colostomy bag, but if it's full, the clients, some people might be having this colostomy bag for 20, 30 years. So they know how to clean it and how to attach it themselves. But we as a personal care assistants, again, we don't deal with internal organs. We only support our clients with the activities of daily living. So what we do is we report it to our supervisors, and the supervisors will come and change if there is a need to change. Now, when you give a shower to the client, be very gentle with the colostomy bag. All you do, you don't rub on it, you just tap the towel on it to dry it out. Okay. Now, if you're not comfortable, you give the towel to your client, they might do it themselves if they're able to. All right. So that's one of the things that you need to remember when it comes to colostomy bag. Now, moving to the next one is about urinary system. Now, when it comes to the urinary system, we as a personal care assistant, again, we report any issues that you may come across. So one of the issues that you may come across is the clients may have very dark urine. Okay. If you come across a client who's when they when they go to toilet, pass urine, you see that the urine is very dark, report it to your supervisor. And also, if you see that your client is behaving abnormally, for example, on a day-to-day basis, they interact with you. For example, one of the client knows Lorna, okay? Lorna, he knows. And he goes every morning, he goes like, good morning, Lorna. And today he's like, who are you? What do you want? Like a sudden behavior change. Like, what happened to this person all of a sudden? He doesn't remember me, or he's behaving very weird, and he's like, I don't know your name, I haven't met you before. Weird questions. He seems to be very confused. Now, in these situations, you report it to supervisor because a person may be having a urinary tract infection. Urinary tract infection, which is in short, it's called as UTI. Now, in these situations where the person has a UTI, or, to identify if the person has a UTI or not, they might do urinalysis. Urinalysis is just like a pregnancy test. It's a urine test that they may have to do. And then usually we don't do it again. It's the nurses who do it, but you need to report that this person is confused. They might sometimes ask you to just put a pan in the room, in the toilet, so that, when they pass the urine, they can collect and do a test. Or they may ask, if it's a male, they may ask them to ask the client to pass the urine in a bottle, okay, so that they can do the test. And if they identify any issues, then the doctor will recommend that we send the urine samples to the pharmacy. To the pathology. And the pathology will do the test, and they send the test results. Upon the results, the doctor will write antibiotics for the client to help them, recover from that particular infection. Now, moving to another one, when it comes to urinary system, we may have to assist our clients with catheter bags. You all know what a catheter bags are, urine bags. Some clients may have urine bags, so you might have to empty these urine bags every 2 hours. You might have to empty these urine bags every 2 hours. And one of the things that I want everyone to be careful when you're assisting a client with a urine bag is, some people, you have to really understand, it's, I cannot actually, no, it's not very practically possible. But I can show you as an example what you need to be careful about. Now, do you see that there is a strap around this particular bag that goes on the leg? Now, some people, because this strap is going behind this bag. Now, what a lot of people do is they try, because they don't know how to put it, because they're very new, or they don't know how to do this. What they do is they do it over the bag. And if you do over the bag, what happens? Obviously, you're restraining the urine. So when the person passes the urine and it doesn't go through, the pressure goes backwards. And what happens? The pipe will break. And the urine is everywhere. And why? Because obviously you didn't put that strip properly. And you may ask me, does supervisor do it? No, we PCS do it. Supervisors don't do that. Supervisors usually, they assist you. Sometimes nurses also don't do it. They call doctors to insert that urinary pipe, catheter pipe. But when it comes to showering, you can't give a shower to the client you have to remove those strips completely, strips completely, and put them back to a side when you're giving it to a shower to a client. Okay. Now that might get wet, the bag might get wet, but the strips should not get wet, because obviously if they're wet, it's going to be, not comfortable for the client. Especially, nowadays it's cold. Okay. No one, even during summer also, people don't want it. Obviously they don't want to put something that is wet. So you might have to remove the strips, and you might have to redo the strips when you assist your clients. Is that clear for everyone? So just be careful, and you don't understand, you ask your supervisors. That's what I say. If you don't know something, there is nothing wrong in asking your supervisors. I hope that is clear for everyone. Now, with that, we have covered most of the body systems, but let's also look at few other things when it comes to some of the body systems. For example, cardiovascular system, one of the things that I want everyone to be aware of is there are three functions of our cardiovascular system. Please write it down. Three functions of cardiovascular system: transportation, protection, and regulation. These are the three functions of cardiovascular system. Now, what is a cardiovascular system? It transports blood to almost all of the body tissues. And it also delivers essential nutrients and oxygen and removes carbon dioxide. And that's one of the functions of the cardiovascular system. Now, moving to the next body system, next function of the cardiovascular system is protection. The cardiovascular system protects us from infections and also helps us infections in simple words. So through its white blood cells and red blood cells. Now, white blood cells, they help in cleaning up the cellular debris and fight pathogens. Whereas the red blood cells and platelets, what they do is they form scabs. Now, for example, when you get hurt or when you had a scratch, okay, what happens? After a few days, there is a black layer that is formed on your skin. Now, this black layer, scabs, it's formed because of this white blood cells and red blood cells and platelets. Now, the purpose of this is to ensure that the body fluids are not leaking out of your body and the bacteria is not entering into the body. That's the purpose of this. So that's also one of the function of cardiovascular system. And another function of cardiovascular system is regulation. Now, cardiovascular system also helps us in regulating the homeostasis in our body. In simple words, it helps in managing the temperature and the blood pressure in our body. So when we're talking about the temperature and blood pressure, so in simple words, I want you to understand when the body temperature goes high or low. Okay, when the body temperature goes high or low, when you're too hot or too cold, the information is sent through nervous system. There is something called in our body. I repeat that one, guys, once again. When the body temperature goes high or low in our body, it's sensed by thermoreceptors. It's sensed by thermoreceptors. These thermoreceptors, what they do is they send the information through nervous system to the brain. And in the brain, there is something called hypothalamus. You just write down the words for now. You can read more in the PowerPoints as well. There's something called hypothalamus in our brain. This hypothalamus will then get the information and it sends the information back to the heart. Now, depending on whether your body temperature is high or low, the heart will work according to it. In simple words, when the body temperature is say high, then vasodilation happens. And when the body temperature is low, when the vasoconstriction happens. I'll show you what is vasodilation and vasoconstriction. Now, these are your blood vessels. So, these are your blood vessels. Now, that's an example of vasoconstriction and vasodilation. So, when the body temperature goes high, it vasodilates. When it's low, it vasoconstricts. So, that's how the body temperature is managed. And not only just blood vessels, but also apart from this, the integumentary system will also help us in managing the body temperature. So these are the three functions of cardiovascular system. I'll repeat that once again: transportation, protection, and regulation. These are the three functions of cardiovascular system. And also we need to make sure that when it comes to body pH levels, potential of hydrogen. Now, this is only for your knowledge. Again, it's not like you're going to read the reports or something because we got a couple of questions. So that's why I'm giving you additional information on this. Now, the potential of hydrogen in our body should be between 7.35 to 7.45. The pH levels in our body should be between 7.35 to 7.45. So that's body pH levels. And it's maintained by respiratory system and kidneys, which is excretory system. So, or urinary system. So in order to have good pH levels, we need to have healthy diet, like, raw meat, like not raw food, and not processed meat. Okay. So healthy food in simple words. Now, what happens when the pH levels, potential of hydrogen levels are less than 7.35? If the potential of hydrogen levels are less than 7.35, the body's environment is said to be as acidic. And if it's between 7.35 and anything above 7.35 is called alkaline. Okay, acidic. Lower than 7.35 acidic. Higher than 7.35 is alkaline. Now, what is a good environment? Good environment is alkaline environment. Now, when our body pH levels are less than 7.35 and they are acidic, it means that the cancer cells or any kind of diseases may survive and multiply or progress, may harm. That's why our body's pH level should always be higher than 7.35. On an average, it's between 7.35 and 7.45, which is good. So that's one of the things. And apart from that, I don't want to really go deep into some other things because it's not needed as a personal care assistant. Now, most of the things I believe that we have already discussed, but there's one other thing that I also wanted to show when it comes to cardiovascular system and respiratory system. How do they work together? Cardiovascular system and respiratory system, how do they work together? I'm going to play a very short video for you to understand, because you have to label this diagram and also you have to write about how does cardiovascular system and respiratory system work together. So I'm going to play this short video. It's only a 2 minutes video. I pause in between and explain to you.
Vessels containing blood flowing to the heart, while arteries are blood vessels containing blood flowing to the heart, while arteries have blood flowing from the heart. The blue is representative of blood vessels containing deoxygenated blood, while the red blood vessels have oxygenated blood fresh from the lungs. Now, let's follow the path of the blood through the heart. The superior vena cava receives blood from the head, neck, upper limbs, and chest. Meanwhile, the inferior vena cava receives blood from the trunk, viscera, and lower limbs. Both the superior and inferior vena cava end up in the right atrium, one of the 4 chambers of the heart. The heart not only has 4 chambers, it also has 4 valves. The purpose of the valves is to keep blood moving in the right direction and not flow backwards. Blood exits the right atrium through the tricuspid valve, so called because it has 3 flaps, and enters the right ventricle. The blood exits the right ventricle through the pulmonary valve and enters the pulmonary artery. Again, it is an artery because blood is flowing away from the heart, but it is blue because it lacks oxygen. The pulmonary artery then splits into the left and right pulmonary arteries, which go to each respective lung. In the lungs, gas exchange occurs. The blood discards carbon dioxide and picks up oxygen. Now, blood comes back from the lungs through the pulmonary veins, entering the left atrium. Next, the blood is pumped into the left ventricle through the mitral or bicuspid valve. Finally, the oxygenated blood leaves.
All right, guys, I'm just going to quickly go through this. So this is how the blood flows through the heart, and also this is how the cardiovascular system and the respiratory system will work together in order to ensure the healthy functioning. So what happens is, from the upper part of the body, which is through the superior vena cava, deoxygenated blood enters into the right atrium, and from the lower part of the body, it enters into the right atrium. Deoxygenated blood enters into the right atrium. Now, to control the blood flow, there is a valve called a tricuspid valve. This helps this deoxygenated blood enter into the right ventricle From here, the blood is pumped to the respective, through to the respective lungs to get it oxygenated. And once they're oxygenated, they enter into the left atrium through pulmonary veins. They enter into the left atrium, and through mitral valve, it enters into the left ventricle. From here, the blood is pumped to the entire body through aorta. Okay, and that's how the blood flow happens throughout our body. And this is how the cardiovascular system and the respiratory system, they work together. Okay, that's about cardiovascular system and the respiratory system. And when it comes to muscular system and the skeletal system and muscle also work together in order to ensure that they enable the body to move comfortably. For example, guys, I request everyone to please make a note of slide number 55. I request everyone to please make a note of slide number 55. So the muscular system also provides protection to the internal organs and produces heat and maintains correct posture. Without the muscles, the bones of the skeletal system would be unable to move, because these muscles and bones, they are connected through tendons. The muscle is attached to the bone through tendons. And this supports the movement. Whereas the bones to bone is attached through ligaments. The ligaments will support the flexibility and the stability, whereas the tendons will help in attaching the muscle to the bone. Because of this tendons and ligaments, we are able to move comfortably. Okay, that's how muscular system and skeletal system, they work together to enable movement in our body. Okay, now I'm not going to discuss much about it, so I hope you guys are clear with whatever I have discussed so far. That will help you to complete your responses. Okay, now I request everyone to please send me your email addresses in the public chat, guys. Everyone, please send me your email addresses in the public chat. All of you, please send me your email addresses. Once again, I request everyone to
Excuse me, sir.
addresses in public chat. First onto the camera, Sonia.
Sir, sorry, I just realized halfway you discussed with us, I realized that I actually unit number 6 I already in last on the 4th of March.
Yes.
I'm so sorry. Can I leave now?
That's fine.
Or can I just listen?
Yeah, that's fine. You can.
Yeah, all right. Thank you. So I no need to send you my email this week, yeah?
That's right. You don't have to. But
yeah,
if you want, I don't mind.
Yeah, thank you, sir.
So,
Excuse me, sir.
Yeah.
So I missed my last Monday's class. So I just took this class for Unit 6. It was my last unit. So I think I don't there's not my name in the attendance. So yeah.
Yeah, we'll get to the attendance. That's when we can talk about it.
Okay.
And Om and Susma, I think, Saraswati. Om and Saraswati, next time you guys send me email, you have to make sure that you send it separately, not together. Okay, because it's hard for me to type it in. Like I have to literally type it in. No, next time. Right, I believe that you guys have received the assessment now. I believe you have received the email, everyone.
Yes, sir.
Sir, I did.
All right, I'm just gonna go through the assessment.
Sir, I don't get.
Yep. If someone has not received it, check your spam emails, and then you have to wait after the attendance. You have to remind me once again so that I can send it to you. And that's your assessment for unit number 6. Assessment for unit number 6. The assessment is due on the 24th of June. 24th of June. So it's a pretty simple assessment, guys. Just focus on what I'm telling you. It will be easier for you to finish it quickly if you focus. Now, question number 1, what they're asking is, write about different body systems and the functions of this different body system, and make sure that you have included all of these in the functions. Okay. Now, how do I address this particular question? Write about different body systems and the functions of different body systems, and make sure that these things are included in those functions. Is that clear?
Yeah.
Everyone. So you're writing about those 11 or 12 body systems, and make sure that you include all of these in those body systems. Ensure you're writing about the functions and making sure that all of these are addressed in that body system. Now, this first question is just about the body systems, nothing else. Just the body systems and the functions. Okay, in the functions, which body system is covering what? Okay. Now, in question number 2, the question is again similar, but this question is not about body system. The question number 2, they're asking you to create a healthy body maintenance fact sheet. Healthy body maintenance fact sheet. For example, Sonia, if you're not on the camera, I've been advising you multiple times, but if you're not on the camera, your appointment will be delayed, because obviously you observed a few times, but I let it go. If students are not on the cameras, I will also be delaying your appointments. I'm telling you very clearly. Okay. Because if you're not being very dedicated, you trouble me, I trouble you. It's both ways. Okay. So, and other students, not just Sonia. Sonia, I have just kept an eye on her. All right. Now, moving to the next question, question number 2. So clinic, for example, you go to clinic, doctor's office, you see some posters there, right? In the doctor's office, advising you what to eat, how to keep yourself healthy, and so on. Yeah. Now, this question is similar to that. They're asking you to create a flyer or a poster that you can put it in the doctor's office or any clinical center. Now, in this, what you're doing is you're writing about how to maintain body temperature. For example, when your body is too hot, what do we do? What do we do when you're hot? You wear minimum clothes, bare minimal clothes. We have cold drinks. We turn the air conditioning on and we try to keep ourselves cool. Okay. When the body is hot. The other way around again, when the body is cold, we wear additional clothes, we drink warm drinks and keep ourselves warm. The same way, what do we need to do in order to maintain good blood pressure? Now, for example, for good blood pressure, it's always good to do regular exercise. and running. Now, the reason behind why do you have to do regular exercise to maintain the good blood pressure is to make sure that, is to make sure that you're healthy, but doing regular exercise will release nitric acid, and this nitric acid will help us to maintain good blood pressure. Now, something like this. Now, you're talking about general things that you may do, and how does it assist to keep you healthy? Okay. And apart from this, what are the benefits of active exercise and what are the benefits of passive exercise? And how do you keep yourself safe from any kind of infection? And how do you protect yourself from any kind of infection? Now, how do you protect yourself from any kind of infections? Make sure that you're healthy, eating healthy things, have a balanced diet, make sure that your immune system is strong. So you might write about what kind of food to eat, what to avoid, and you may also talk about the benefits of active and passive exercise. Now, what are the benefits of active exercise? Any answers? One of the things is it helps in blood pressure, good blood pressure. It helps in maintaining good body weight. It improves your muscle flexibility. Now, these are some of the benefits of, and it also improves your heart health. These are some of the benefits that you may write. And also, you will be writing about what are the benefits of passive exercise. Now, what is a passive exercise and what is an active exercise? Active exercise is you are running, you are doing activities by yourself. These are voluntary activities. You're doing these activities by yourself. Whereas passive exercise is basically involuntary movement in your body. For example, you are not moving it. For example, a physiotherapist is helping you to move. Now, usually these kind of things happen, like, passive exercise is usually done when someone had an accident or they had a stroke or something else. So they may not be able to move it by themselves. So the physios will help them so that they can assist them with the muscle flexibility and so on. I repeat that once again. Active exercise is all about we doing things voluntarily, like exercise and running. Passive is when we are not able to do, someone is assisting us. That's passive. Example, a physio is assisting you to move the legs. Okay. Move the legs or arm. And these are the images of passive exercise, guys. Now, what are the benefits of this passive exercise? It improves circulation. It improves circulation. It helps in muscle flexibility. It improves the muscle strength. It improves the muscle strength. It improves the circulation. It prevents the weakness, muscle weakness, and fitness. And stiffness, sorry. It prevents the muscle weakness and stiffness. Now, moving to the next question, guys. I hope you guys are good to go. And in this particular question, you might put some images. You might copy some images and put them in to show like a poster. All right, guys. You might show a picture, have a picture that has hand hygiene, someone washing hands. You might have a picture of someone assisting someone else with the exercise. Those kind of things can be included. Now, moving to question number 3. Why is it necessary for healthcare workers to use and understand accepted healthcare terminology? Just give me 1 second, guys. All right, guys. So why is it necessary for healthcare workers to use and understand accepted healthcare terminology to describe the normal structure, functions, and locations of the major body systems? Why is it important, guys?
To
Because
avoid any type of confusion, wrong communication.
yes,
It will lead to wrong treatment.
and it will affect the quality of services of the client.
Yes.
Those are the things that you'll be writing about. Now, question number 4. Question number 4, please understand this question very carefully. What they're asking you is write about 10 human body systems and what organs do they include. For example, cardiovascular system includes blood, heart, blood vessels. Integumentary system includes skin, hair, nails. Just like that, you're writing about the body system and what organs are included in each of the body system. And you're writing about all 10 of them. Question 5, what are the 8 things that should be considered in maintaining a healthy body? Any 8 things, adequate sleep, drinking 2 liters of water, 8 glasses of water, list 8 of them, okay? Now, question 6, what are the 3 functions of cardiovascular system? Transportation, protection, and regulation. You got that in the PowerPoints as well. Now, in question number 5, you have written about 8 things to keep yourself healthy. Now, in question 7, you're discussing any 4. You might have to provide additional information. What are the benefits of exercise? What are the benefits of drinking 8 glasses of water? Something like that. Anything that you think, okay, you want to write about. Now, question number 8, I request you guys to refer to your slide number 55. How does cardiovascular system and respiratory system work together? How does muscular system and skeletal system help in enabling the body movement? You can refer to your slide number 55. Now, question number 9 and 10, I'll discuss in a minute. Now, with question number 11, what are the principal parts of human cell? Plasma membrane. Plasma membrane.
Cytosol, organelles, nucleus.
Nucleus. You just need to mention them here. You don't have to discuss them, just mention them. Now, these are only 11 questions that we have. Out of them, we have 2 pictures, 2 diagrams that we need to label. So you got the words here, and then you got the diagrams. You just write down the answers in its numbers, okay? Now you got 2 diagrams. I'm happy to go through those diagrams. I want everyone to be organized with the pens, whatever you want, pen, book, whatever you need. Please organize yourself. I'm going to discuss them now. Now, students who have not received the assessment, please send me your email address. Students who have not received the assessment, please send me your email address. Asmita, I have taken your name. Next time, I will please send it on time. Anyone else? Kulvinda? Anyone else? Asmita and Kulvinda, I've just sent you the email. I hope you guys are ready. Now, the first one is a right pulmonary artery. The second one is superior vena cava. Third one, right pulmonary veins. Yep. Fourth one, right atrium. Fifth one is tricuspid valve. Sixth is right ventricle.
Can you please repeat?
You can see it on the screen, my dear. Who asked me to repeat, guys? Who was it? Who was it?
Me.
What's her name?
Sonia.
Sonia. Oh, you just wanted to show that you're present. You're still not present. You can see it on the screen, Sonia. What are you doing? All right, yeah, number 8 is aorta. Number 9 is left pulmonary artery. Number 10 is left pulmonary veins. Number 11 is left atrium. Yeah. Number 12 is bicuspid valve, or I think you have it in your words as a mitral valve, so you can write it as mitral valve. And then you have left ventricle. And then you have apex, APEX. That's right pulmonary artery, superior vena cava, right pulmonary veins, right atrium, tricuspid valve, right ventricle, inferior vena cava, aorta, left pulmonary artery, left pulmonary veins, left atrium, mitral valve, left ventricle, and then the last one is apex. Now, if you're looking at your assessment, guys, you're looking at your assessment. When you're facing your assessment, your left hand side becomes right and the right becomes left when you're labeling. Good to go, everyone? Now, please be careful with left and right, guys. Once again, your left becomes right, right becomes left. Now, let's look into the labeling this skeleton diagram. Now, the first one is skull. The second one is mandible. Third is cervical. Fourth, thoracic. Fifth, lumbar vertebrae. Number 6 is pelvis. Number 7, sacrum. Number 8, coccyx. Number 9, clavicle. Number 10, scapula. Number 11, sternum. Number 12, ribs. Number 13, humerus. Number 14, radius. Number 15, ulna. Number 16, carpals. (17) metacarpals. 18, phalanges. 19 is femur. 20 is patella. 21, tibia. 22, fibula. 23, calcaneus. 24, tarsals. 25, metatarsals. 26, phalanges. I believe everyone is good to go. All right. So with this, we have completed this particular assessment. It's a very short assessment, and you'll be sending this assessment to my email by next Saturday, which is the 24th of June, 2023. And I believe everyone is aware that you have a term break for next 2 weeks. And the next session will be held on. So you have a 24th, which is off. First is off. So we're back on the 8th of July. When are we back? Back on the 8th of July, which is after 2 weeks. After 2 weeks break, which is the third week, we're having this session on the 8th of July. Now, also wanted to let you know one other thing, okay? Moving forward from July, your sessions will be on the Saturday online, yes, but no longer I have to chase people. The good thing is we are back to face-to-face. So, which means not many people are going to be happy about, but it is what it is. So on Saturdays, you have an online session. On Sunday, it's a face-to-face session. So if you ask me a question, oh, do I have to come on Sunday? The answer is it's a mandatory. Yes, you must. That's starting for 1st of July. So 1st of July is obviously it's a day off. You guys are starting on the 8th. Now it's not just for you, for everyone. Okay. Now, so far what we have enjoyed is that COVID allowance that has now stopped. So whichever RTO you're studying with, whichever college you're studying it, they all are going to call you face-to-face from now on. All right. Is that clear for everyone? Are you all happy to come?
Yeah.
Do I have a choice? I don't know. Unfortunately, I can't answer that question, but yes, that's the advice that we have got. So yeah, I will see you guys after the holidays. So what I'm planning to do is I'm planning to run the session online, the lecture, and the assessments and any other questions or any other lecture additional points will be discussed during our face-to-face session. So just for you to be a bit more clear on expectations. So usually what I do is on a Sunday, I don't usually ask people to come at 9. I ask them to come at 10:15. So next month onwards, which is July onwards. So your session will be on Saturday lecture for an hour or so. And then Sunday will be 10:15. You'll be coming face-to-face. That's
one question.
Yeah, that's where, just give me 1 second, Maria. So that's where you complete your assessments as well, where possible. Try to complete the assessment in the classroom because the assessments will be given to you as a hard copy. I print it out and give it to you. And it's the same, everyone, whether you're talking, Ramutu, I'll talk to you, my dear, after. So it applies to everyone. We don't differentiate people. It's the same. So it's a Saturday is online, and Sunday is going to be face-to-face. So assessment will be like, how I'm sending it online now. I'm not going to send it online. I'm going to print them up, give it to you in the class. and we discuss in the class, and then you complete your responses in the class and you give it to me. And some students are, well, I know some students, especially who have kids, they're a bit more worried. How do I go about it? I don't mind if you bring your kids, as long as you can maintain them. All right. So I hope that is clear for everyone. Okay. Anyone has any questions?
Okay, sir. One question. Let's say I can't attend on Saturday. I mean online, and then can I do for Sunday?
See, I don't recommend. One of a time is okay, but not always.
All right. Okay.
One of a time, you know, you have missed a Saturday, it's okay. You may come on Sunday, it's okay. But if you're missing this on every Saturday and Sunday, every Saturday, and you're coming only on Sunday, that is also not recommended.
Yeah. And then what should we bring? I mean, on the class, should we print ourselves?
No. I'll give you the printed assessment.
Oh, okay. So
all you need to bring is, you might bring your laptop if you want to, and or you know, just make sure that, you know, sometime where possible, I recommend that everyone completes the assessment in the classroom and give it to me and go, so that, you know, your course is much more smoother as well. Yeah, but sometimes, depending on the situation, depending on how they're doing with their course, I might even let people go early and they can complete it online. Not online, I'm just say at home and bring it back next week. But that will not be the instance in every situation. Okay.
Or can I discuss with you on the class on Sunday, and then I'll email it to you later, which is like a Monday. Is it possible?
I'm not going to take emails anymore.
Oh, all right. Okay.
Once we start face to face, I prefer to have them all hard copies.
Oh, okay. Thank you, sir.
No worries. Now, so all right. So
Yes, sir.
I've marked.
Sir.
Yes, Sonia. Sonia, can I talk to you about the end of this session? End of this session, please.
Yeah.
I request everyone,
Sure.
everyone, please don't discuss your personal circumstances before the attendance, because you're wasting 44 people's time. Individual questions I answer individually, guys. Anyone who has any questions, whether it's about the session, whether it's about the unit, whether it's about anything, keep it to yourself for now. All right, Sonia, I'm sorry.
Yes, sir.
You after. Okay. Now, Soumya, I have answered your question. Sorry, I have marked your attendance, Sonia. Soumya, government funding student, Soumya.
Yes, sir.
Yeah, okay. I was thinking you left.
No, sir. My mouse is not working. That's why.
That's okay. All right. So yeah, just Soumya. All right, Soumya. I'll see you after the holidays.
Yes.
Now, Anjana, and guys, once I mark your attendance, if you do not have any question, you guys can leave. Once I mark your attendance, you guys can leave. If you do not have any questions, students who have questions will stay back, and I'll see you guys after the term break. That is on the 8th of July, online again. 8th of July is still online. Okay, 9th will be face to face. Now, Anjana Lama. Anupa.
Present, sir.
Arman Noor. Arshdeep. Ashmita Bandari.
Yes, sir.
Asmita Magar.
Yes, sir.
Astika Sedai. Bandana.
Yes, sir.
Shelly. Deepika.
Yes, sir.
Marked. Shelly is there? Dilini marked. Dilsi
Yes.
marked.
Yes, sir. Thank you, sir.
Gurpreet. Gursharandeep.
Yes, sir.
Marked. Hari marked. Hari is here, yeah?
Yes, I'm here.
Harpreet? Harpreet Kaur? Isha?
Present, sir.
Jamila marked. Jaspreet?
Yes, sir.
Jessica?
Present, sir.
Thank you,
Jyoti?
sir. Have a nice day.
Present, sir.
Yes, you. Marked.
Present, sir.
Jyoti marked. Kabita? Kamalpreet?
Present, sir.
Marked. Kulvinda?
Present,
Sir,
sir.
Gobita.
What were you doing, Kabita? Marked now.
Sir, Isha.
Isha marked. Tina? Laldinenga?
Present, sir.
Marked. Lipu marked. Lorna marked. Mahima? Manisha? Maria marked. Maria Tiffany? Marianne? Michael? Mohan marked.
Present, sir.
Om marked. Pavitra? Pratignya?
Yes, sir.
Marked. Pratik? Pratima? Pooja Thapa?
Yes, sir.
Marked. Raju? Raju Tamang? Rivaj marked.
Yes, sir.
Riya? Roshni Buddhatoki? Sabina?
Yes, sir.
Marked. Samiksha? Sapna?
Yes, sir.
Marked. Saraswati?
Yes, sir.
Marked. Shanti? Simran?
Yes, sir.
Marked. Sophia? Sohit? Sonika?
Yes, sir.
Marked. Sohit marked. Sonika? Sony Bugatti marked.
Thank you.
Christina? Sukhjeet?
Thank you, sir. Yes, sir.
Christina and Sukhjeet marked.
Thank you, sir.
Sukhmanpreet? Suraj?
Yes, sir.
Marked. Tuidang? Tripti? Tripti? Sharing?
Yes, sir.
Tripti marked. Sharing? Sharing Tamang? All right. If I have not called someone's name, please send me your full name and student ID in the public chat.
Sir, solid
Mark me.
Jessica, you're marked.
Thank you.
Sir Goma.